got my order, I've got my supplies, I'm doing a head-to-toe assessment. I've looked at my patient history. I'm going to perform hand hygiene and into the room. Good morning, my name's Autumn. I'm going to provide privacy. We're going to be doing a head-to-toe assessment on you today. Can you tell me your name and date of birth?
Billy Goetz, 10/07/1943.
Perfect. Billy, do you have any allergies?
Yes, penicillin and sulfa.
Okay, so I've checked that with his identification and his MAR. And it looks like he is orientated to self and only place. So can you tell me where you are today?
I'm at the clinic.
Okay, I'm going to perform hand hygiene. Perfect. So ANO times 4, he's orientated to the place. I'm looking at his general posture, and it looks like he's laying supine. He's got good hygiene. I don't know any abnormalities present while I'm just looking at him. There's no tubings, no ostomies. He does have his mobile toilet here. Other than that, I don't see any aids that would assist him. I'm also going to ask him if he has any history with any cardiovascular, respiratory, musculoskeletal, neurologic, ear, nose, and throat, or any skin conditions that we should know about.
Nope.
All right, and then it looks like your vital signs, taking them here, and you're at a pain rating of 3 out of 10 on your abdomen. And I don't have any foul odors that are present. So I'm going to go ahead and start here with his eyes. Looking at the conjunctiva, it looks like it's pink and moist. The sclera is white. I don't see any drainage or exudate here. I'm going to go ahead and palpate around the hair, just looking for the distribution, any wounds, lesions, any infestations. Was there any tenderness there?
Nope.
Okay, and also his eyebrows and eyelashes are also evenly distributed. I'm going to go ahead and shine my light here in your eye. Alright, and the eyes are reactive. Can you look at the edge of my pen and then at the ceiling? Alright, so pearl is intact. I'm also going to have you follow my pen light with just your eyes. Okay, 6 cardinals of gaze. And I'm looking at the nares. They're even and equal in size. Septum is midline, and they're patent. And can you say ah? Very good. Stick your tongue out and puff your cheeks out. Okay, smile, frown. All right, face mobility is good. I'm going to be looking at the ears, any drainage. I don't see any drainage or any excess cerumen. And I'm going to palpate here. Let me know if there's any tenderness. The pinna, the tragus, and the mastoid. Any tenderness?
Nope.
All right, so I'm going to be going down to the carotid arteries. Okay, I'm assessing that it's +2 bilaterally. There's no JVD that's present, and I'm also going to listen for any bruits. Okay, I'm going to assess turgor. It's non-tenting. And I'm going to go ahead and listen to your chest here for your lung sounds and also your heart sounds, okay? So when I move my stethoscope, take a deep breath in and out. Okay, listen through the full cycle. And it sounds like there's an adventition sound, slight wheezing on expiration. And I'm also going to listen to your cardiac sounds as well so you can breathe normal. Okay, so the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, so S1, S2 are noted. I'm also going to palpate for any tenderness and percuss as well on the thorax. All right, so I'm going to feel on your joints. Is there any tenderness?
Nope.
Okay, can you squeeze my fingers? Very good. Roll your wrists and bend your elbows. Arms out to the side, up above your head. Okay, touch your nose. All right, touch your fingers and pat your thighs. Okay, so coordination, range of motion, and then press up against me. Press down, and it looks like your strength is strong as well. I'm going to be looking at the hands. Cap refill on both sides, less than 3. Radial pulses, they're equal bilaterally +2. I'm looking for hair distribution, any wounds, lesions. Your skin is dry, pink, and it looks like we do have a skin tear here that's covered with trichoderm, so it's not intact. There's also an IV here on the left arm. And I'm going to go ahead and listen now to your abdomen. And I'm looking for any distension, any abnormal color distribution. Okay, listen to the bowel sounds, all 4 quadrants. All right, and they're active vowel sounds. I'm gonna go ahead and palpate here. The abdomen is non-tender and soft. Can you do a little crunch for me? Okay, perfect. There's no hernias present. And all right, I'm gonna look at your perineal area. I'm looking for any erythema, any irritation. It's a female, so I'll spread the labia. I do know a strong urine odor. Okay, and if I could have you roll over for me. Just gonna assess the backside. Looks like luteal fold is free of erythema and irritation as well as the anus. Just looking at the rest of the posterior side, he has a 3-inch scar from an incision on his upper back in between the scapulas, and the posterior portions of the legs are also clear of any abnormalities. Okay, you can roll back over. I would change out my gloves then to do the rest of the assessment, put on new gloves that are clean. Let me know if there's any joint pain here. Any pain?
Nope.
Okay, so I'm gonna have you roll your ankles again, bend your knees, lift your legs, and then it looks like there's a little bit of a limited range of motion there. Press up against me, push down against me, same here. Okay, perfect. So I'm gonna look at your pulses on your feet here. Your pedal pulses are even bilaterally, +1. Looking for cap refill, those are both under 3 seconds. And I do note you have a wrap on your left leg. Babinski is not intact, so that means there's no neurologic damage. And I'm also gonna assess here for edema bilaterally. All right, and you're free of any edema here. All right, if I could go ahead and have you sit up, I wanna listen to your lung sounds. Okay, nice deep breaths. Very good. Also looking at the spine, it's symmetrical. It looks like his respiratory rates are even and symmetrical on the posterior side. Is there any tenderness here when I press on the spine?
Nope.
Okay, good. And again, I would note that 3-inch scar that he has in between the scapulas. All right, just make sure I didn't forget anything here. Okay, if I had time, I would go ahead and see if there's any abnormalities in vision. In hearing, I could do the Rhine and the Weaver's test or the Snellen test as well. And I'm going to take off my gloves, perform hand hygiene, bed in lowest position, and call light in place.